Hi, I'm Sue Waltermeyer, and I'm a certified child life specialist. As part of my role as a child life specialist, I help interpret the medical environment for children so that they can understand what it is that's happening, what they're going to be experiencing, and help them cope with that. And one of the important things for me as a child life specialist to remember is that sometimes kids take things very literally. They're, especially our preschoolers, very concrete operational thinkers. And so when we tell a child we're going to take your blood pressure and we're going to take your temperature, children sometimes literally think you're taking something away from them. They see that blood pressure cuff fill up, and it must fill up with something. It's called the blood pressure cuff, so it must be blood that it fills up with. And so we want to use language that helps convey appropriate information that a child can't misconstrue because it has more than one meaning. So we check temperatures and we check blood pressures. Words matter in healthcare for kids. Sometimes if you are trying to explain something to a child and you feel like they're reacting differently than you expected, press the rewind button. Was there a word in there that maybe has more than one meaning? There's lots of words in healthcare that we use just very casually and comfortably because we work in the healthcare field and we know what they mean in this context, but our children don't always know that. You know, shot can be a shot put, it can be a gunshot, it can be a shot of whiskey, or in the healthcare environment, most likely a shot in the arm. We use words like, I'm going to flush your line. Well, my experience with flush is we flush the goldfish or we flush the poop because I just got potty trained and things go away when we flush. And you're going to flush something in my hand, will my hand go away? And so sometimes just being aware of the type of language we use when we're working with children in healthcare is really important. Words matter. Another thing that helps when kids are very anxious in a healthcare environment and they're expressing their anxiety and their fear by yelling or crying is everyone wants to comfort them and reassure them. Their parent wants to comfort them and reassure them. The nurse or healthcare provider wants to comfort them and reassure them. And certainly the child life specialist, who sees that as part of our role, wants to comfort and reassure them. And what happens in those situations when you have a crying, upset child is that everyone's voices escalate to be heard over the crying child. And that just enhances the stimulation in the room. And everyone starts to feel overstimulated and everyone's anxiety starts to get revved up. And so in those situations, what I do is I drop my voice because then people have to be quiet to hear me. Sometimes that doesn't always work, and so a cue word that we might use might be one voice, or we just have one person speaking to the child instead of 3 or 4 or more. It can be the parent, it can be the nurse, it can be the child life specialist, whoever's most appropriate in that instant to be giving information to the child. And again, when we want to help children understand what's going to happen, we need to give them sensory and sequential information. In what order are things going to happen, and what are they going to look like, smell like, taste like, feel like? And what we're doing is helping children trust us. When the nurse says, I'm going to tie a rubber band really tight around your arm, and then I'm going to feel with my finger on the inside of your arm, and that's exactly what happens. Then when the nurse says, the next part is I'm going to wipe the inside of your arm with a little cold, wet wash. And that happens just like they said. And the next part is you might feel a little pinch. It will only last for a second. We're giving the child appropriate sensory information and appropriate sequential information, and the child starts to trust, okay, what they said is happening just the way they said it. We want to use appropriate language that identifies what's happening but is not scary. So when we have a child, for instance, who's being a little uncooperative because they're scared and they don't want that needle in their arm, we can tell the child, if you don't hold still, we'll hold you down. Or we can tell the child, it's hard to stay still when you're scared, and if you need help, we'll help you. We're going to be doing the same exact thing in that situation. We're going to be holding the child and keeping them still for the procedure. But by using different language, we're either setting the child up to fail and punishing them, or we're helping the child be successful. And so sometimes we need to look for ways to commend the child on how they're coping, even if it doesn't seem like they are at all. You're doing a great job letting everybody in the building know how much you don't want to be here and have this done. Everybody knows that. You're doing a good job telling us. Kind of a backwards compliment to a kid who's screaming really loud. But words matter, so think about what you're saying and what you want the child to understand, and if there are words that maybe they might not understand in a medical context because they have more than one meaning. Thank you.